So in summary of this component, simply collection and processing the liking survey generated a valid and reliable diet quality index. And based on the dietary assessment goals, the liking survey could provide sufficient information on diet quality for child and family, as well as group nutrition education ideas. And combining the liking and frequency-based screener increased the precision of predicting nutritional status, including carotenoid status. So next, I'd like to share some findings from the full intervention with carotenoid status as an outcome. So again, one slide had the control group, preschoolers, and the other was the intervention, and we had 100 children in each group. The groups were matched at baseline, and the intervention was really adding minutes of nutrition education and physical activity. And it went from October to March, and the whole program followed a theory-based and was multi-component involving education with the families too. So considering the baseline analysis, we hypothesized that the intervention would improve carotenoid status, this change in RSS at the bottom, through the influence of the school meals, which I'm going to tell you about, which were teacher reported, as well as the parent reported change in liking for diet quality. So we asked the teachers to tell us how the children did at the lunch, because the requirement is that the teachers sit with preschoolers and encourage communication and the whole skills around mealtime. So they reported how the children consumed vegetables at baseline and 7 times during the intervention and at the end of the intervention. And the focus really was on this ate the same as usual, that category, but as always a poor eater of vegetables, saying the same, or improved since baseline, continues to eat vegetables, and always a good vegetable eater and staying the same, because there weren't that many children in ate less than usual vegetables or ate more than usual vegetables. And across the intervention, there was significant improvements in the number in the drop of poor vegetable eaters, and increases in improved vegetable eaters and increases in good vegetable eaters. So this simple tool, and the teachers had no problem doing this because they had to write down or keep track of how many children got the meals anyways for the child nutrition program. Now, this shows that diet quality from parent report improved across the intervention versus the control. And you can see this change. So the liking survey in the first column, the food frequency-based question. But the liking-based diet quality measure was more responsive to the intervention than the food frequency-based diet quality. And this was a Crystal et al. Responsiveness measure. So what actually happened across the intervention? Well, again, where it was simultaneous relationships between the diet quality, adiposity, and carotenoids. So the carotenoid level increased, but not significantly. And it was likely because, oops, sorry, I have some builds. The strong relationship of SNAP participation of the family on the change in RSS because of the baseline carotenoid status and also the change. So it was just overwhelming effect of that. And also the intervention associated with the increasing of the liking-based diet quality, as I said before. And there was a separate influence of the school meals, as teacher reported, on the liking-based diet quality, and the improvements in liking-based diet quality associated with improved carotenoid status. So overall, with simple collection and processing the liking survey, we found it responsive to the nutrition education intervention and teacher-reported vegetable intake patterns, had the ability to detect changes across the intervention that were consistent with the nutritional biomarker carotenoid status. Yet there was a non-significant change in carotenoid status. And so the question was it really worth the effort? I don't know. You all can chime in on that. And it might be that, wait, maybe that was reality and there really wasn't, there was misreporting on the diet measures. I'm not sure, but this is what it was. So just to finalize, I just want to share some preliminary findings of the Veggie Meter now use in one of our in our Mindful You tailored health promotion program for college students. And this work is supported by USDA HAT. And I do have IRB for all of this, although I forgot to put it on the slides, my apology. So Mindful You is a digital tailored health promotion intervention that was developed during the pandemic with a team of dietetic students led by Patrice Hubert, who was a doctoral student at the time. And this shows all the components of Mindful You, but we're going to really focus on the online survey and tailored message program. And then we were able to bring people into the lab for the baseline measures. And despite really having great recruitment, we still only were able primarily to recruit in women. But we're trying very hard to get more diversity. And the students had to report consuming less than 5 fruits or vegetables a day or less than 150 minutes of moderate to vigorous physical activity per week. So these are our data on 79 participants. The good news is that most they were diverse in academic status and age. And interestingly, a number reported food insecurity. We're looking at that. Some students reported food insecurity, even though they were on meal plans. So we're really trying to understand that and provide appropriate resources and messaging to these students. So we used an online liking, disliking for food, beverage, physical activity, and sedentary behaviors. And an index was diet quality was conceptually weighted, but we were working with the statistician who did machine learning and also tested empirically derived weighting for the diet quality index. And it was used to predict metabolic status. And from these analyses, I'm just going to use a report on the conceptually based index, which had acceptable internal reliability and good variability across the sample. We also did it incredibly simple, and this is one from the initial online survey, simple assessment of intake of fruits and vegetables. And it was just asking people how often they ate healthy foods on this scale and less healthy foods. And we just merely subtracted the less healthy from the healthy foods. We do have a short healthy eating index, the Colby, that we're going to be looking at, but I didn't get a chance to get it together. So we assessed carotenoid status with the Veggie Meter. This is a picture I think I got from a Delaware site just to show. And we screened out for smokers, noting indirect smoke exposure, students who had reported using these edible drugs, binge drinkers, artificial tanning, and high-dose vitamin A meds from the protocol that was reported for the Veggie Meter. And the carotenoid status was variable, but again showed a slight positive skew. So liking for fruits and vegetables on the left, and as well as overall liking-based diet quality index showed significant bivariate relationships with average Veggie Meter scores, as did the frequency-based fruit and vegetable consumption and the frequency-based, that simple frequency-based diet quality score, subtracting the unhealthy from the healthy intake. So because the liking and frequency and multivariate analysis that I'm not showing, but we were looking at that, both contributed uniquely to explaining the Veggie Meter score, we created groups who were concordant or discordant in liking versus intake, following what we've done in previous reports. So we have individuals who report low liking of both, low liking and low intake, healthy eating, low, for both, but also those that are high diet quality liking as well as high frequency intake diet quality. And those who are discordant, either they report liking, low liking, excuse me, I'm getting off here. Let's see, this is, they have a high like for less healthy foods, but say they don't eat them. So that would be an example of restricting their consumption or misreporting. And conversely, they report low liking for healthy foods, but they're eating them. Maybe they're trying to change their consumption, or they also, again, misreporting. So if you look at these groups that are based on concordant, low, low, high, high, or the discordant groups, you can see the biggest difference is between individuals who report low liking and low intake, as well as compared to those that are high. So again, if you want more precision, you would use both measures to try to understand difference in carotenoid status. So overall, we were able to explain variability in the veggie meter with either direct diet measure, either diet measure, fruit and vegetable liking or intake, or diet quality measures. These were similar findings to the preschool study. And we have a preliminary efficacy trial underway, but I'm going to suspect there'll be some challenges in showing the effect of the intervention with the veggie meter, because it could be that students, they come off of being at least in Connecticut, having a rich source of fruits and vegetables because of the fall. And then they come to school and maybe they don't like the fruits and vegetables served, and they don't eat well. And then at the end of the semester, when we're measuring the impact of the intervention, maybe their scores go down. And that's what I haven't looked at it fully, but that's what I might suspect. So thank you so much for your time and attention, and I welcome lots of questions.